call it hospital waste. All these are similar only. Let us look at each of the definitions, what is adopted and why these terminologies have changed. WHO defines healthcare waste as all the waste generated within the healthcare facilities, research centers and laboratories related to medical procedures. Okay. In addition, it could be waste generated during even the home care, that is your home dialysis, self-administration of insulin, recuperative care and all those things. Now we know that, see, the non-communicable diseases are increasing, diabetes is increasing, and dialysis patients are increasing because of diabetes and hypertension. So home-based care is also increasing. People are administering insulin. What happens to these waste generated is a cause of concern. So any waste which is generated out of the healthcare setting, we call it as hospital waste or biomedical waste, and it can be generated from various categories of hospitals, starting from clinics, dispensaries, hospitals, and veterinary hospitals, all these things. So if you can look at, initially we called it as hospital waste. When people thought, oh, it's only referred to hospitals, so no, lab and all is excluded. So they called it healthcare waste. In fact, WHO calls biomedical waste as healthcare waste. In India, we refer this healthcare waste as such as biomedical waste, and it has been defined by the Biomedical Waste Management Rules 2016 as, this is a definition which we all must know. It is the any waste which is generated during the diagnosis, treatment or immunization. Any of these process, okay, it could be either during diagnosis or any treatment procedures or immunization of human beings or animals, okay, or in research activities pertaining. So it doesn't mention this place here. That means to say, wherever this diagnosis, treatment, immunization of either human beings or animals or research activities are undertaken, such places we have this biomedical waste applicable. That means this is referred as biomedical waste. So if essentially hospital waste, biomedical waste and healthcare waste all are the same. Okay. We in India we refer to healthcare waste as biomedical waste. So can you tell me what are the hazards of this biomedical waste? Can you list the hazards? What all hazards we can face because of biomedical waste? Yes, anybody?
Hello, ma'am.
Yes,
Hello,
listen.
ma'am. Ma'am, I'm Yamini. Ma'am,
Yeah.
there are many types of hazards like physical hazards, which maybe which can cause injuries or any harm. For example, like any noise or radiations. Then we have chemical hazards, biological hazards. In chemical hazards, use of acid, spillage, and pesticides. And in biological, any infection, contaminated waste. And then, ma'am, stress can be a hazard also.
Yes. Who all are affected?
Yes, ma'am.
Who all are affected
I-
with our biomedical waste? Who all
Ma'am,
are primarily
ma'am,
affected?
even healthcare professionals and the patients and the relatives or the people who are coming in the hospital settings.
Yes. Anybody else?
Any anybody who
Housekeeping
is in the
staff, ma'am.
contact.
Anybody who comes in
Ma'am,
contact with
needle stick
guest
injury.
community, community also is affected. Then
Housekeeping staff, ma'am.
they are also primarily affected because they are, one is they handle the waste directly and also they do are, their level of knowledge is very less. Yes. Then
Ma'am,
say other.
needle stick injury is also hazardous waste. Chemical splash, like
Hmm.
from sodium hypochlorite, HIV, HCV, HBV can also occur. And
Yeah.
contamination and maybe it also will HAIs. It also lead to HAI, hospital acquired infections.
Correct. Very good. So basically, it can affect everyone, especially the doctors. We are the direct doctors, nurses, and other healthcare providers. Okay, all of them. Those people who are there to give care to the patient, we are affected the first primarily, and subsequently even the patients. We don't want patients who are come for treatment to be getting another infection and going. And other important people are the rag pickers who are handling this waste. If we do not manage our waste properly, they are affected. Okay, so that's how community also will be affected. And poor aesthetics and stray dogs and rodents also can be affected. And more importantly, pollution of the environment. It could be air pollution, water pollution, or soil pollution. We have liquid waste also is coming out of the waste. So that can also cause pollution and injuries to waste handlers, and especially the recycling industries and the rag pickers are at higher risk because they have less. Yeah, what I want one more question: what proportion of our infectious of the hospital waste is infectious or hazardous? If you say
10
100
to
kgs of waste is
15% is hazardous, 10 to 15% is hazardous waste, and 80 to 85% waste.
very good. So it is just about 15 to 20% is hazardous, we can say, not more than that. So it is very important that we separate this infectious waste from non-infectious waste and manage it properly. So this we have already discussed. So who are the people at risk? The patients, the medical staff, support staff, rack pickers, recycling industry also, and waste collectors, and those people working at the common treatment facility as well. These are people at risk. So we all understand that we must safely dispose the waste. So with this concern, do you all agree with me that it's a occupational safety issue? Isn't it an occupational safety issue? Yes, right? I would like to come to this slide, which I want to emphasize. Biomedical waste management, I think it's very important that it's an occupational safety issue, environmental safety issue, because if we do not handle properly, it can affect the air pollution, environment pollution, or water pollution, and also it's a patient safety issue. More important, it is an attitudinal issue. We all feel it is not my job. Okay, doctors feel it's my job is to treat the patient. Nurse will think is to care. Okay, and we dump most of them on the healthcare worker. It is not that. It is that's everybody's responsibility. Okay. Now, coming to that, we all agree that we must safely dispose the waste. Now, coming to the categories of waste, I think you all know this list. We have different categories of waste apart from our general waste. Okay. As I told, general waste or the non-hazardous waste constitute about almost 80%. It's a small fraction is our hazardous waste, that is infectious waste, sharp waste, genotoxic, radiotoxic, radioactive, sorry, pathological, pharmaceutical, chemical, pressurized content. So these there's different. We'll little look at each of them later. If you look at the WHO classification, this is the WHO classification. According to our what to say, practically implementation, we have 4 categories. We'll come to that little later. This is the WHO classification, how it is looked as healthcare waste overall. It is categorized them as hazardous and non-hazardous. Non-hazardous is nothing but our general waste. Hazardous, we have the sharps, infectious, pathological waste, pharmaceutical and cytotoxic waste, chemical waste, and radioactive waste. Okay. Now, hazardous waste, these are all hazardous waste. Now, what do you mean by infectious waste? Something which has pathogens susceptible to suspected to have pathogens. So it could be a non-anatomical. Can you give example for each of this? It could be non-anatomical and non-sharp waste. Example,
Sorry, ma'am. PPT is not visible, ma'am.
not visible. 1 minute, sorry. I'll switch off my video. That's it's coming in the way. Sorry. On this
Now it is visible, ma'am.
okay. This slide you could see before?
Hazards of healthcare waste is what I'm able to see, ma'am.
Correct. Okay, fine.
Thank you, ma'am.
As we discussed, these slides were not visible that time when I was discussing.
No, ma'am, it was not visible.
Okay, I'll just run through these slides. Okay, these are the people at risk. All you and me are at high risk of getting the infections from this thing. So we must dispose our waste safely. Correct? We all agree on that. So this slide I wanted to show you. So we all agree that it's an occupational safety issue, environmental safety issue, patient safety issue, and attitudinal issue. Okay. Now, these are the different categories of waste, and this is the WHO classification. You must all know it's broadly categorized as hazardous and non-hazardous waste. In hazardous, we have sharps, infectious, pathological waste, pharmaceutical and cytotoxic waste, chemical waste, and radioactive waste. Now, what is this infectious waste? something which contains pathogen. Can we give example for each of this? Non-anatomical, non-sharp waste, infectious waste. Can anyone give an example of something, some waste which is infectious, but it is not anatomical in nature and not sharp? I think all of you are from hospital background, right?
Excuse me, ma'am, the slides are not moving.
Not moving. This Google Meet, I have always a problem.
Now it is, ma'am, infectious waste. Now we are on the slide of infectious
Okay.
waste.
Ma'am, solid waste like cotton dressing.
Yes, dressings, cotton dressings,
Mask.
gauzes. Yes, correct.
Mask.
Sharp waste.
Needles, syringes with needles, scalpels.
Yes, needle
Glass
scalpels.
bottles.
Medical and pathological waste.
Lab waste, ma'am.
Lab waste, placenta. Correct.
Yes. Yes.
Amputated body parts. All those are examples of this thing. Offensive human waste, like your stools. Is the slide visible now? See, these are some of the examples. Waste contaminated with example for non-contaminated, non-anatomical and non-sharp waste is like your bandages, dressing, swabs, gloves, cultures and stocks from lab waste, waste from autopsies, okay, waste from infected excreta, and all those things. Sharp waste is your all this sharp materials, blades, broken glass, infusions. See, this is WHO classification. Just remember this. We are giving examples. Don't understand the definition as per rules. We'll come to that little later. Pathology, anatomical waste is like your placenta, body parts, unused blood products and all. And pathological waste like your body fluids, then tissues, organs, autopsy materials like that. Offensive human waste is your use your nappies and sanitary pads. Non-hazardous pharmaceutical waste. We have in pharmaceutical waste also we have two types: non-hazardous and hazardous. Non-hazardous is all your normal saline, cough syrup, vitamins, etc. Non-hazardous. Hazardous are epinephrine, nicotine, warfarin, etc. This category also includes items heavily contaminated during the handling of pharmaceutical waste. Also, they are also considered as pharmaceutical waste. Now we have also special category called as genotoxic waste. This is very highly hazardous because they have potential to be mutagenic. That means it can it can cause genetic mutation. Teratogenic because it can cause defects in embryo or fetus when the individual is exposed during pregnancy, or it can cause cancer properties. If it has any of these, as per WHO, it is considered as genotoxic waste. All these are cytostatic drugs like alkylating agents, antimetabolites, cancer treating patients on radioactive materials. These are all some of the genotoxic waste. These are special attention should be given to this type of waste, which can have a very serious effects. Next, coming to the cytotoxic waste. This is one which is used for cancer treatment. This is
Ma'am, slide is not moving.
oh, this is problem with okay. Sorry. Now, where are you seeing?
Yes, ma'am.
Genotoxic slide is there, no? Okay. Now, cytotoxic waste. Okay. Next, we have the chemical waste, as you all told. Any discarded chemicals which are used during the disinfecting process, and it can be hazardous. Like it could be toxic, it could be corrosive, or it could explode, or it can be chemically reactive. Okay. Examples like non-hazardous chemical waste also will be there in our hospital, like sugars, amino acids, all your transfusion fluids. Some with those with heavy metals are considered to be highly toxic, like your silver, lead, etc. Is the slide moving? Okay, next type of waste is the radioactive waste. Radioactive waste is one which is generated during your procedures, which are in the radiology department when they are doing imaging and all those diagnostics procedures. It could use radiation, disused sealed radiation sources or liquid and gaseous materials contaminated with radioactivity and excreta of patients who underwent radionuclide diagnostics. So all your radiotherapy department waste will essentially come to this radioactive waste. And radioactive healthcare will often contain radioactive nucleotides with short lives. So these are different categories of waste. Now, understanding this, we have what is in our country we follow new rules, that is biomedical waste management rules 2016, which has been implemented in 2016 and further amended in 2018 and 19. This forms our basis for understanding different category of waste. So you could see there are so many categories of waste in our uh, hospital, but in under the biomedical waste rules we have categorized them into four color coded. Can anyone tell why this color coding? We have four color coded: yellow, red, white, and blue. Can anyone tell why this color coding?
Ma'am, for treatment as per the category.
Very good. The basis of this category color coding is basically because of keeping in mind the final treatment and disposal option. Okay. In fact, anybody knows when did we have first rules on biomedical waste?
Ma'am, 1998.
Yes, 1998. Do you know what? How many categories were there?
10.
Yeah, we had 10 categories. In our hospital, we could see that there could be 10 containers, different types of waste. They would separate all the categories separately and manage the waste. But now, because of thanks to biomedical solution, they have simplified to make it easy for everyone and to be practically feasible. We have made it into four color codes: yellow, red, blue, and white. Now, let's look at what goes into yellow. This is
And human and animal anatomical waste, solid waste,
ah,
and
laboratory
chemical
waste.
waste also,
Yes,
lab waste.
yes, correct. So these are different categories of waste which are considered as yellow. But mind it, we are not going by category of waste of healthcare waste. We are not telling infectious waste will all go to yellow. Infectious waste will go into yellow, or it could go into even sharp waste, white, or it could be in red. They are all primarily infectious only. But keeping in mind what is our final treatment option, we have divided the color coded containers. Okay. Even before that, I would want to talk of these four R principles: reduce, reuse, recycle, and recovery. Can anyone give example? We must follow this principle to manage our waste properly.
Yes, ma'am, in lab waste as we autoclave the petri dishes.
Yes.
In lab waste as we autoclave the petri dishes and
Yes,
sometimes slides also, pipettes also.
that is reuse, right?
Yes.
Petri dish and all, you'll autoclave and reuse it. That is reuse. Reduce means reduction in the generation
Reduction.
only. Or like for example, you manage your waste effectively so that it doesn't go for expiry and generate waste. Okay,
Yes.
and green purchasing policy we follow. If you have to use cotton swab, don't use unnecessarily large amount. Use it
Yes.
as required. Okay, that is reduce. Reuse is what you gave example, like petri dish, glass bottles to be reused. What is recycle? What is the difference between reuse and recycle?
Ma'am, reuse is as we are reusing the same like petri dishes as we are pipettes we are reusing. And
Yes,
recycle that like Baslery bottle we are crushing and recycling it.
very good. So in reuse, we are using this item in the same form, whatever it is. If it is a bottle, we are using it as bottle. If we are using petri dish, we are using it as petri dish. But after auto claving, that's it,
Yes.
right? Uh,
Yes, ma'am.
Whereas recycle, it will change its form and we'll use it in different. For example, your glass IV bottles can be shredded and made into a bucket or a plastic container. But usually they do it for non-food products, not for the thing. So we have to keep this in mind. Recover waste means any example for recover waste?
Recovery.
No. Mercury, all these precious metals which we can recover, like mercury, silver. Before X-ray films and all, we used to recover silver, right? Those called as recovery. Lead. Okay, these are examples for recovery. So if you look at biomedical waste management, we have to approach it as a system. Okay, as a complete system. It's not a single thing. We need to have a good policy in place, SOPs in place, records in place, and good management. And baseline for all this, we need to keep in mind our worker safety and also patient safety. And so, what are the steps? We have segregation first, then disinfection at source, then collection, transportation within the healthcare facility. This I'll again deal next in the subsequent class in this thing, but now I'll just touch upon this. And finally, we have to treat and dispose it. Okay, this is a different thing. We will come back to this little later. Today, my focus will be on categories of waste and especially segregation. So, of all this thing, which is the most important step you all feel?
My most important is segregation.
Yes, segregation is one of the very important step, and I think it is the golden or heart of our biomedical research. Segregate at source. Okay,
Yes,
segregation
only
at
generator is
source will be the
responsible.
primary step. Once you do this, half work is done, and from here we need to continue the segregation process till its final destiny, whatever it is. Okay. Now, what is the advantage of segregation? Anybody can tell?
Ma'am, if the segregation is appropriate, then we can then the HCW healthcare waste facility, who is the common treatment plant, can treat the waste as per the ruling,
Very good. Any other reasons?
and it will also generation low non-compliances.
Yes, very good. You are complying to the pollution control board rules. Yes,
Yes,
good.
and we are generating diseases very low in amount. HAI from biomedical side will be zero. Then, if the segregation will be
Very,
appropriate.
very good. I think we told most of the answers. This is the first step. Simply, it means separating different types of waste into different categories based on color coding. The characteristic of category of waste we have already told based on its hazardous nature and also based on what is the final treatment option. What is the advantage? It reduces the quantum of infectious waste which we need to manage. So essentially, you're also managing the cost. You need not pay more for the severity of based on the quantum of the waste. You can reduce the cost of management of this waste, and also looks hospital. Our hospital will look clean, and it reduces spread of infection and injuries by minimizing the contact. Okay, I think you've all seen these color coded bags, and these bags should all have biohazard symbol as per biomedical waste management rules 2016. And for cytotoxic waste, they will have C symbol. Okay, that is one thing extra. And all our plastic should not be basically it should be non-chlorinated, and it should be more than 50 micron thickness. Okay, this is as per plastic waste management rules 2016. Now let's look at the type of waste, different categories of waste, how it is going. Now, human anatomical, we already told no what all types of waste can go into yellow. It could be your human anatomical waste like your placenta or amputated body parts. Animal anatomical waste like your experiments if they are doing any. Anyway, now in the medical college, it will stop mice and all because of animal rights people. For any experimental waste or even your veterinary sciences, if they have some animals body parts, that also goes into yellow. Our placenta, fetus, if it is less than 24, along with the copy of the official MTP certificate, you can hand it over to the biomedical waste treatment facility. This is one group. Next, we have soiled waste, which are contaminated either with blood or body fluid, like your plasters, shoe covers, face masks, casts, head caps. Okay. Then your linen, mattresses, then beddings, which are contaminated with the blood of. This will happen only when you want to discard your bed or beddings if it is torn and you want to throw it.
Ma'am, will a human anatomical or animal anatomical part will go in double layered yellow poly bag?
Double layer sending? Yes, you can do that. That procedure came basically when we started our COVID to reduce
Yes.
the chances of infection, reducing to chances of
Actually, in
breakage of
our
skin. If you are
hospital, we are
doing it, it's a
doing it
good practice.
from very first, that from 2008 we are doing in our hospital.
That's a good practice. You can always continue. No harm. Okay.
Okay.
Next important category is blood bags, vaccines, lab culture. These are all one of the special category of waste in the yellow category, which are to be pre-treated at your hospital level itself. Okay, Even though you are giving it to the common treatment facility for further treatment and disposal, still the rule mandates that we need to autoclave or hydroclave or microwave. Any of the procedure you can follow. Even chemical disinfection also is okay, but not with chlorinated plastic, chlorinated chemicals. Okay, non-chlorinated chemical disinfection also we can do. If places we don't have, if small places we may not have autoclave, right? There they can put it in a non-chlorinated chemicals, disinfect and then discard into yellow if your lab cultures or culture materials are there. Okay, so all this will go into yellow. So these are the things. What will happen to this at the sea?
Ma'am,
Yeah,
incinerate.
pardon?
Ma'am, in CBWTF, they incinerate the yellow category.
Correct. All your yellow category waste goes into common biomedical treatment waste treatment facility. According to our rules in India now, if we have a common treatment facility within how many kilometers radius? Anybody have an idea?
75.
Yeah, within 75-kilometer radius of our hospital, if we have a common treatment facility, we have to hand over our waste to the common treatment facility. We can't treat by ourselves. Only in conditions where, because I see most of the states have this adequate common treatment. Some states are still in the process of establishing common treatment facilities. Such places, they what should they be doing? They have to they can have their own facility, but they have to stringently follow whatever the rules is permitted with the permission of the permission of the pollution control board. They have to operate the waste. So the first option is incineration at the common treatment facility. If there is no common treatment facility, what will they do? Say there is a remote PHC. Some places we have seen in Odisha and all when we have traveled. There are
Ma'am, they can have their own, but they have to follow all the parameters of air pollution,
they
water
can have
pollution.
their own, but it is very difficult. If you say
But
PLC, you might have.
otherwise, they can send it to the nearby CBWTF, like the if they are at countryside, then in the
Okay.
main city.
Okay, even if that is not available close by, what is the other option we have? This I'm only telling in the remote chances when common biomedical waste facility is not there.
Then, as per my perspective, they can have their
Anybody
own.
have any idea? I think most of the places are connected to common, but some of the places are still there. Then they can go for deep burial. Okay, but of course you can't put blood bags and all into deep burial. Your anatomical waste, soil waste, infectious waste can go into deep burial. That is only in places where there is no common treatment facility, but they have to get permission from the pollution control board. Is this clear? So, what we understand basically yellow means to incinerate. So, that in mind, you must keep in mind that anything that can be burnt can go into incineration. But we have here a tricky situation. We have blood bags, which is plastic. We say don't no plastic should go into yellow bag, right? Because it may contain PVC, polyvinyl chlorine, which can release toxic fumes, that is dioxins and furans, which are called as persistent organic pollutants, or we call it as it's known as dirty dozens. UN has listed 12 pops or dirty dozens they call, and somebody has a question. Joyanta has some question.
Ma'am, for the yellow, you said that plastic, but blood transfusion bag should keep in the yellow, ma'am.
Which one? Blood bag. Yeah, I'm coming to that. Except for blood bag, no other plastic should go. We had a discussion with pollution control board also and to the ministry also. Except for blood bag, it should be, if it is non-fluorinated, it is okay. But anyway, blood bag, they think it is very highly infectious, and so it has to be autoclaved and then put into yellow. Okay.
Ma'am, if there are placenta bags, if there are plasma bags,
Plasma bag also. Anything which is coming off from blood bag
component of
going into
yellow.
yellow. Currently, it is going under yellow. Okay. Actually, under the rules, they have amended that, saying that all our healthcare products which are plastic should become non-chlorinated. If that is there, even if this mix is fine, but we do not know. Anyway, current situation, blood bags is the only plastic which will go into yellow. Even vacuum also there is always a question under the program. Now it is going to yellow after autoclaving only. Okay. Now next category of waste we have is the pharmaceutical waste and your cytotoxic waste. Pharmaceutical waste you need not dispose it every day. You can accumulate in one place in pharma stores or somewhere. Then you can hand it over together, or you can return back to your manufacturer, who will in turn hand it over to uh, the CBDWF. Cytotoxic ducts also have to be separately collected. Again, this will be the same yellow color plastic bag, but it is a separate colored bag, which is separate color in the sense yellow only, but it has cytotoxic C symbol as you see on the right side here. Okay, all your cytotoxic symbols should be separately labeled and sent. Expired drugs and discarded drugs, either you can send back to manufacturers or to the common treatment facility or to the hazardous waste treatment facility if you have connection. Okay. Now coming to the liquid waste also, we categorize them as liquid, chemical, it's called categorized as yellow, but we do not put it in cover, but it has to be treated. That means to say it is also considered as hazardous and infectious. Appropriately we will have to treat. For example, if it is silver X-ray film, we have to send it to the silver nitrate recycling unit. And infectious secretions, we must appropriately treat it with sodium hypochlorite solution or autoclave, whichever is. For example, sputum, how do we disinfect in the National TB Elimination Program?
And please repeat the question.
চলে গেল কি বলছিস মনে বলে রেখেছি তুই অনির্বাণ সরকারের নাম্বার জানিস তো ওটা সুখে মাঝে মাঝে
How do we treat
না কি মনে
we use phenol, right? 5% phenol. Is the voice echoing? Hello?
Yes, ma'am, now you are audible.
Yeah. So chemical, we do appropriate treatment has to be done either by chemical or autoclave and then send it to the ETP or through ETP and STP finally. Okay, your chemicals should be neutralized. Next, is it clear? Yellow color category, what all goes?
Yes.
Now coming to the red. Red is basically for plastics and rubber materials. You can remember like that. For all plastics and rubber materials, all contaminated waste. Red is for recyclable. Okay, remember as red as recyclable. Your IV tubings, IV bottles, IV sets, catheters. Then
Ma'am, where will go that thermocol, like in which test tube vacuum-tainers are kept?
Vacuum tainers, we have a problem here.
No, thermocol.
Pardon?
Thermocol that are made up of thermocol, in which vacuum tainer we keep that are made up of thermocol.
Thermocol, what is the material? I think it can go into yellow if it is contaminated.
Okay.
Okay. So vacuum tainers, I have just put it here, but actually in the guidelines they have put it as yellow itself. Okay, don't whatever you are practicing, you continue as yellow only. But it has to, because we thought mostly it's plastic, we have put it here. But anyway, I would try to delete from here.
In hospital there is issue because in some wards there is need of vacuum tainer, but they generate in very less quantity, like 3 or 4. So it is very difficult for
As
them
per
to
the
handle
program
that.
now, as per the rules, it is saying as yellow only. We'll put it there till we get clarity. Actually, we can put it into red once we autoclave it because it's predominantly plastic. Anyway,
Ma'am, actually, it is very difficult to send to lab for them. Only 3 to 4 they are generating.
but
So
you can't dispose it directly. You have to autoclave. That is the rules actually. Vacuum cleaners have to be autoclaved before you send it directly. Okay. So in red color things, even your syringes without needles goes into red color. Again, it should have the biohazard symbol, and the cover should be more than 50 microns. And what will happen to this recyclable waste plastic in the CBWTF? It can be either autoclave or hydroclave, whichever methods they can follow, and then shred it and then send it to registered recycler. Okay, this will go for recycling industry. Excuse me, just a minute. I'll just come back. 1 minute. Sorry, thank you. Now coming to the white. White is basically metallic waste sharps. Okay, it could be your scalpel blades or suture needles, needles from needle tip cutter, syringes. So what container we are using? We are using white translucent, tamper
Needle
proof,
cutter.
leak proof, puncture proof container. Okay, it has to have all these three categories. Tamper proof, that means to say nobody should be able to mishandle that waste within the shafts. It should be leak proof, that means it should be sturdy and thick, and it should be puncture proof so that the needles or the shafts what is there should not come outside and injure the people who handle these shafts. Next, what happens to this shafts once collected 3/4? This need not be discarded every day. You can collect it because you are going to hand over complete container to the CTF. It is not emptying
And
like
what is the maximum durability that we can keep blue and white?
blue and white. There is no maximum limit as such. Until it is 3/4 full, you can keep it. Okay. Whereas yellow and red, every more than
Every
48 hours you can't. 48 hours is the limit.
Ma'am, 2/3 of the volume has been filled up. Then we can send to the.
Send to the common people. If it is not, next is blue. I think somebody is switching on. Can you silence yourself? Yeah, thank you. Blue, it has two components. One is the glassware, all your broken, discarded will go into blue, and also metallic implants, that is your orthopedics department ka waste, that is your implants, screws, plates, and all those things. So those will go into blue category of waste. Okay. Again, even this blue category of waste should be puncture proof container with blue marking. Before it was cardboard box with blue marking. Now it is nothing like that. It could be blue container with blue mark or blue marking. So this is the procedure. So we are going in for again in CTF. It will be autoclave, and then any questions?
Ma'am, the dental implants, because I am a nodal officer of infectious diseases here in ESI Medical College, Joka, Kolkata, and MD in micro. So another thing, dental implants and the surgical clip, that also kept in the blue category, ma'am.
Yeah, it's a
Metal implant, dental ka, dental surgery.
I want to use the tab material.
Dental implant, ma'am.
Does it have sharps? Sharp edges?
No, not sharp. It is not sharp, ma'am.
It is small like
Clip and dental implant can be put.
A white category is white.
Okay,
Here,
ma'am.
the contents are bigger ones can be quality for recycling. Whereas our sharp is not recyclable. We don't give. Okay?
Yes, ma'am.
Sharp waste is not recyclable.
White category. Correct. Correct, ma'am. Yes, ma'am.
So
Correct.
it will go for sharp or encapsulation or inert. Whereas this metallic implements, they can separate it and it can be recycled. Bigger ones, not the smaller ones.
Ma'am, there is one question from my side. Is it mandatory to do the weight at ward area also?
It's up to your convenience, madam. Why we do that is we'll know the quantum of waste generated, or at the end also you can do whatever is convenient and feasible. In our hospital, we do ward wise. We collect the data, and it is weighed at each ward and then collectively calculated, so
That
that
there should
we know that there is no pilferage in the process.
okay. And the foot pedal bin should be there.
Pardon?
The foot pedal bin should be there.
Yes, yes. It should be pedal with pedals. It should be there. It should not be handled with our hands.
And ma'am, what can we do with the dressing trolleys?
Dressing tables, there you be wearing the gloves. Voice disturbance.
Ma'am, the blue box has been obsolete now
No, you can
because
any Panchami I request all others to okay. I'll just submit my Any questions till this point you have with relate to category of waste and categorization into segregation into different colors? No. Now we'll move on to the exercise just to know how much you are.
Ma'am, there is one question from my
Hello,
side.
ma'am. Just wanting to know that how we can
Your voice is
discard the
not audible.
narcotic drugs.
Is it audible now, Yamini?
Yes, ma'am.
Hello, ma'am. I have a question. How we can discard the narcotic drugs?
Come back again.
Hello, ma'am. How we can discard the narcotic drugs?
I didn't get your question, ma'am.
Ma'am, she is saying
Ma'am,
that how can we discard narcotic drugs?
Narcotic drugs. You're from Punjab?
ma'am, I am from Delhi.
Delhi. You're using it in it's a pharmaceutical drug, right?
Ma'am, we are using in our hospital. That's why I'm asking this question.
No, no. That narcotic drugs comes under pharmaceutical waste, right?
Ma'am, that comes in the pharmaceutical waste, but we are using in OT operation theater. So I just wanted to know how we can discard it.
Ma'am, if it is empty, depending on the container, you dispose it into blue or red. Okay. If it's a plastic, you put it into red. If it's a glass container or vial, you put it into blue. Did I answer? If there is waste within it, I mean there is drugs which is still there, then you put it into yellow.
Okay, ma'am. Thank you.
Okay.
Ma'am, there is one question from my side that how the bins should be covered and foot pedal. Then what can we do with the dressing trolleys?
Yeah, dressing trolley, it's a temporary situation where you do that. Once you have that, you have to empty into the container whatever you have. There you
But
can't get food operated, right? There you can have, it's a small amount of waste is generated, but the end of either shift or the end of the day, you must transfer it to the bigger container.
that we can keep, like in our hospital we have open buckets, but they are color coding.
No, in the dressing trolley, it's okay, but not in the wards and OPDs and all.
No, 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 only in dressing trolleys.
Dressing trolley also okay, but ensure that it doesn't fall. Finally, our aim is to see that safety, right? Patient
Yes.
safety, our occupation, our healthcare worker safety. We ensure that it doesn't fall off easily. That is all.
Yeah, yeah, ma'am. We have open bucket in which we keep that bag. They are
Ah,
color coded.
that is fine as long as it is safe and it is not accessible to anybody and everybody.
Okay.
Okay, now
Ma'am,
we'll yeah,
that cardboard boxes for blue are not recommended now.
no treatment.
Not recommended.
Not treatment at our hospital level. At the CTF level, they will autoclave and then send it to the recycler.
No, no. Cardboard boxes for blue bin, like in that from a
See,
very.
before they used said cardboard box. Now they've removed from the rules mention of cardboard box. If you have cardboard box, it should be puncture proof. It should be thick one, not the normal one, because you will have glass sharps, right? It might penetrate and it will injure the workers. So it can be your blue container only. In that you can put the cardboard box or blue color or something. Blue marking should be there, but ensure that whatever you are putting, it's thicker, because you have glass sharps which are there within that, which can injure the people who are handling the waste.
Okay.
Okay, now a small exercise time for you all. Now you must tell me what color code this waste goes into. Can you see the picture? Doesn't come. Okay.
Yellow, ma'am.
If I put it in slideshow, you're not able to see. I move to the next slide. Tell me whether you're able to see or not see. What is the picture you're seeing now?
Placenta.
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 Now
Placenta, ma'am.
it's not shown. 1 minute. Hold on. Okay, 1 minute. Just give me a minute. Okay, I got some picture to you. Can you
Placenta will go to the yellow category because anatomical waste is there.
correct. This one,
Ma'am, the tablets go into yellow.
1 minute. 1 minute. I just want out the names of the person so I request everyone to use your name. Okay, thank you. Okay. Sir, can you tell me what type of question? Where does it? Okay. Sir, Govinda sir, sir, and mute yourself.
Your
Yes,
voice
ma'am.
is not.
What type of waste is this and what color it is going into?
Ma'am, the tablet will go into the yellow and the strips will go into the green. If the capsules are there, then powder will go into the yellow and capsule plastic part will go in red.
Okay, fine, good. Next, can I pick up someone else? Arfat,
And this will go in yellow.
yellow. Okay.
And this glass
Blue.
and will go into the yellow. If the drugs are there, then it will go into glass ampoule will go into the blue. If the drugs are there, then go into the yellow.
So here is a point. All your cytotoxic waste, irrespective of the material, everything will go into yellow. Okay?
Okay.
Together it will go into yellow. We are not going to separate it by this thing. Okay? Next. Ampules and vials.
Ma'am, ampoule will go into the blue in the after
Blue category.
This one.
and this is the metallic implant. It will go into the blue.
Metallic implant in blue.
Blue. Yes. Why is there
And white for translucent container.
Okay, next is
Yellow.
yellow. Good. This one.
Blue.
Ma'am, if this is a plastic, then go into the
Ma'am, it is if it is made up of glass, go into the
Ma'am, the
blue
cap
category.
will be removed.
and the
Yeah.
cap will go into the red.
Petri dish go into the yellow category.
If this
Yeah.
we have this can go into
First, ma'am, pre-treatment is needed, then go to the yellow.
Actually, if you technically speak, 100% going to yellow. So Joyce, so can you mute yourself? Not this thing I'm getting. Joyce, sir, can you mute?
Ma'am, if it should be first pre-treatment should be given, then go to the yellow category.
Yes, sir. Sir, can you please mute? Yeah. Now is this clear? Shravani, my voice is clear now? Yeah. Okay, thank you. Is it better now? My voice?
Yes, ma'am. Yes, ma'am.
Okay, thank you. Jayanti sir, if you want to answer, you unmute yourself, talk, and again mute. Because I'm getting
Ma'am,
excited.
ma'am, it should be pre-treated and go to the yellow category, the microbiological waste and the petri dish.
Please mute yourself.
Yes. Sure.
Thank you. Next.
Yellow.
Ma'am, after empty, then it will be then go into the red.
Yeah, it has to be emptied and then go into the red. Correct. Linen.
Yellow.
Yeah, here you
Yellow.
can't put it into the bin. What you can do is you can tag it yellow like color this thing and then discard.
Metal will go in blue.
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 Good.
Blue.
Cardboard will go into yellow.
Red.
Why yellow? Until unless it is not contaminated, it's a general waste. You can reuse for something, okay? Not everything will go into color coded thing, okay?
This will go into yellow. Yellow.
Go into
Yellow.
Okay, this one.
This is my central line
White
wire. This will
container.
go in the leak-proof
White container.
White. Okay.
Red.
Red.
Yellow.
Red.
Red. Sorry.
It's red, okay?
White.
White container.
White.
White.
red,
Red.
Red.
white,
White.
Yellow.
Yellow.
Yellow. Good.
white,
Red.
This plastic part will go in red and other in white.
Plastic will go into
Fillet part is white.
will go into the White. Okay, good.
Red.
Ma'am,
Yes.
Red.
Red.
needle
Red.
And
to the white.
needle will
Needle
go
is
in
in the
white
white.
and plastic in
White
red.
will separate, put it into the red, the rest will go into red.
Red. Yellow,
General.
ma'am.
Ma'am, if it is contaminated, it will go in yellow, otherwise in general.
If you use it for tongue depression or examination, then it will go into yellow.
Shoe
Red.
cover, if it is of plastic, then go in red. If it is of fabric, then go in yellow.
Very good, very good. This is why I wanted to know. In your hospitals, depending on the material, you decide. If it's a plastic, let it go to red. If it is non-plastic material, it can go into yellow.
Yellow.
Again, petri dish. You can
That
reuse it, or if you are
At
dismantled, you can
tradition,
autoclave it and then
it is we can reuse after autoclaving.
yes, needle
white.
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 Ma'am, where will go the earbud?
Earbuds yellow.
Earbud is flute contaminated, it will go in yellow.
Yeah,
This yellow.
And
Yellow.
ECG electrode
yellow. It is
is
red, not yellow.
red.
Yellow.
Red.
Ma'am,
Not
gloves will
yellow.
go
Not
in
yellow.
red or yellow?
It is red.
Red.
Gloves, right? Rubber material will go into yellow. Sorry, red. Because if you put rubber material into yellow, it will in the incineration it will go and stick to the walls of incineration and brings down the efficiency of incinerator. So we advise to put the gloves into red.
And these
But
Blue.
are the
ma'am, it is
broken MTs
contaminated
will
with
go
Blue.
glucose.
Blue.
red.
Red.
Syringe,
Red.
we have to cut the hub and discard it in the red.
Red.
After
Ma'am, after
autoclaving, it will go
autoclaving,
into
will
the
discard
Where? Discard to where?
yellow.
Yellow. Blood got is
Yellow.
directly to yellow.
Red.
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 After emptying.
After emptying, it's red.
ma'am, ECG electrode.
This
Blue.
electrode, what is it made of primarily?
मैम प्लास्टिक भी है हल्का सा मेटल भी होता है
Metal भी होता है ना. Okay. Predominantly, which one you feel is more hazardous? You
मैम
can put
प्लास्टिक
the plastic. Okay.
मैम रेड
In red, sorry, in red waste.
Blue.
Blue.
White.
White.
This one,
Ma'am, what is this?
blue
Slide.
plastic.
blue
Slide.
Slide.
This has been
Yellow.
disinfected and then not yellow, white. Sorry,
White, ma'am.
blue.
Blue.
Flash lights into blue. After disinfection in your lipo solution or something, then you put it there. Again, empty and red.
Red.
Ma'am, yellow.
yellow मैम
Blue.
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 Here comes a problem. If there is leftover vaccine, then you must put it in yellow.
Ma'am, for the vaccine vials, do we have to remove that rubber cap?
No, don't do anything.
No.
Empty, because we don't want more hazard to the people who are handling waste. Empty vaccine vials after vaccination, put it into
Blue.
Blue.
this leftover, expired, those kind of vaccines should go into yellow. Okay, because vaccines comes under yellow.
Excuse me, ma'am. In our hospital, what we do is
Yellow.
whatever the leftover vaccine is there, we
Yeah.
discard it in a tissue and we put that tissue in yellow bag, and this vial will be again in the blue bag. Is it right way to do, ma'am?
It's fantastic. You have given me a very good solution. This is all our little bit gray areas, and I think that solution is very good.
Okay, ma'am.
No problem.
Yellow.
white
White.
Why blue? It is
red
This is white. Somebody said blue.
White. White.
white
White. Red.
Red.
red
Red.
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 yellow
Yellow.
Yellow.
Blue.
Blue. Blue.
yellow
Depends upon the material.
Depends on the material. If it is
Yeah.
plastic, put it into red. If not, you put it into yellow.
Red.
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 It's general waste. Okay, after emptying,
Ma'am,
Lysol.
but plastic bottle.
No, but it is general waste. It's not contaminated with blood or bloody fluids, right? You will have so
Okay.
many such products in your hospitals. You do not put everything into biomedical waste. Okay.
Ma'am, then sterlium bottle and sanitizer bottle also go in green or red.
You can send, you will not send it into red. You can use it for something else or send it to general plastic waste.
Okay.
Ma'am,
It is
it
not
means
contaminated, right?
it means ma'am, whichever thing is not contaminated, we have to discard in the general waste.
It's a general waste.
Okay.
Yellow.
Yellow.
If you have a doubt, consider it as biomedical waste. If you don't, if you are very clear, it is not. See, for the example, this there is no question of contamination, right? We're not using for treatment or diagnosis or vaccination purpose. It's clear for cleaning purpose. So it will be
Ma'am,
empty.
but if it is handling with contaminated hands by the sanitation workers or
That means the whole hospital waste will become like that. That means the quantum of waste will be very huge. It's not required.
okay.
White.
White.
Needless exchange will go to white. Okay. When you're not able to separate, especially like insulin syringe, you put it to white. This also we already.
Yellow.
Yellow.
White.
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 Yellow.
Yellow. Yep.
White.
White.
White. Yeah, blue.
Vacuteners.
Yellow. After
Yellow.
treat.
Yellow.
Yellow color. Okay. Thank you. Good job, all of you have done a good thing. So clap for
Excuse me, ma'am.
yeah.
Excuse me. Ma'am, can you repeat how do we discard the sputum containers?
Okay. Sputum in NTP under the program only. If you have all your sputum containers, put them in 5% alcohol, leave them for overnight, and then discard that into the ETP or whatever STP drain, whatever you have. The container can go into red.
Ma'am, we have to treat it with 5% hypochlorite solution.
5% phenol.
5% phenol, or if it is hypochlorite, then
You should not use hypochlorite because it will stink.
okay, ma'am. Okay. Thank you.
Thank you, ma'am.
Yeah.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
I
Thank
put
you,
one.
Thank you,
ma'am.
ma'am.
I put one video.
You, ma'am.
Wait, I'm not done with the presentation. I have one video to play. I'll play after that. You can.
Okay, ma'am.
Excuse me, ma'am.
Tell me. Play the video. Tell me. Tell me.
Ma'am, can slides will be shared?
You want this slide?
PPT. PPT
I'll share
that
it.
you have taught.
I'll share it with the Tapan sir. You can collect. Ask him. Huh?
Okay, ma'am.
Ma'am, can I lift now?
Pardon?
I have to see. Can I lift now? I have to see one patient.
Okay. Sir.
Thank you.
Just a minute. I'm just taking time to load the. ಇದೆಲ್ಲ ಡಬ್ಬ ಬಾಕ್ಸ್ ಇದೆ ಈ ಕಡೆ ಡ್ರಾಲ್
How are you doing?
Fine, thank you.
Just wanted to, since I just came to talk, I might as well wish all my teachers. So I'm back from Yalaka.
Oh,
Had a fun time. I'm gonna miss it.
is it?
Yeah, because it was right next to my house, so I could get there in just 10 minutes. Here it takes me almost an hour,
Okay.
so I can get up earlier.
Okay, I present the thing video. Just tell me if you can hear me in the video. One minute. Is the video visible?
Biomedical waste management.
No, ma'am. It's not visible.
No,
Seventh
no, ma'am.
largest
Okay, I'll do it again. Is it visible now?
biomedical waste management.
No, ma'am.
No, ma'am.
Okay, 1 minute. I'm trying to share this.
Biomedical waste management.
How about now?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay.
India is
Can
the
you hear?
seventh largest and second most populous country in the world.
Yes, ma'am. Ma'am, not audible.
Beings or
You're not able
animals,
to see?
research activities, product.
You're not able to hear?
Ma'am, able. No, ma'am.
Problem with this Google Meet.
Ma'am, you switched off both the mics, so we were not able to hear.
Oh, 1 minute. Hold on. Nothing was heard till now?
No, ma'am, nothing was heard.
1 minute. Okay, now? Is it audible
Biomedical
now?
waste management.
Yes, ma'am.
Okay.
India is the seventh largest and second most populous country in the world. The healthcare sector is growing at a tremendous pace. While it provides care and treatment, it is a significant contributor of waste. Hence, management of biomedical waste is an integral part of any hospital system. The World Health Organization estimates that about 495 tons of biomedical waste is generated every day. An average of 0.27 kgs of waste is generated per bed per day. Biomedical waste may be defined as any waste generated during diagnosis, treatment, immunization of human beings or animals, research activities, production or testing of biologicals, or at health camps. The different categories of waste generated are anatomical waste, infectious waste, microbiological and laboratory waste, chemical waste, pharmaceutical waste, plastic waste, glass waste, metallic waste, and sharps waste. The various hazards of biomedical waste include infections like hepatitis B, HIV, and respiratory infections, genotoxicity, chemical toxicity, and injury by sharps. In addition, biomedical waste, if mismanaged, can pose environmental risks such as air pollution, water pollution, and soil pollution. Improper combustion of biomedical waste can release dioxins and furans that are known human carcinogens and are associated with a range of adverse health effects. Individuals at risk of being injured or infected due to biomedical waste include doctors, nurses, laboratory
Ma'am,
technicians,
video is not visible.
patients and their visitors, workers in common biomedical waste treatment facilities, workers in recycling industries, rag pickers, and general public as well. The four principles of biomedical waste management are reduce, reuse, recycle, and recover. Reduce the amount of waste generated by having good purchase and indenting practices. Reuse items like petri dishes and culture plates. Recycle waste like glassware and plastics. Recover waste like silver and mercury wherever possible. Biomedical waste should be scientifically managed as a life cycle approach from generation to final disposal. It has the following components: segregation, pre-treatment, collection, on-site transportation and storage within the healthcare facility, followed by off-site transportation to the common biomedical waste treatment facility, and final treatment and disposal.
Ma'am, video is not visible.
Yes, thank you. 1 minute. I'll play another video. Yeah, this segregation I'll play, and after this we'll close this session. It's just a 8 minutes video.
Segregation of biomedical waste.
Is it audible?
Yes, ma'am.
Is the
Yes.
part of efficient management.
Ma'am, video is not visible.
Hmm. Ma'am, audio and video is not visible.
Needs to be
Video is seen?
pre-treated either by autoclave, microwave,
No, ma'am.
before it goes into the
Now?
yellow bin. They
Ma'am,
are
audio
blood
is audible.
samples,
Are you able to see
microbiology
or not
based,
see?
clinical
Ma'am,
development,
video is not safe.
bioinformatics based.
Problem with 1 minute, hold on. You could see halfway through. Now is it visible?
Either by autoclave,
No, ma'am.
amputated
Now?
body part,
No, ma'am.
dead fetus
What is
below.
the problem with this? Now it is seen. Is the video seen now?
Segregation of
Ma'am, only desktop are showing.
segregation is the heart
Is it?
of efficient.
Dr. Suman? Sorry for this. I always problem with this Google thing. Okay, I'll select the window. Okay.
Segregation of biomedical waste.
Now?
Segregation is the heart of
Yes, ma'am.
management
Okay.
of biomedical waste. Segregation simply means to separate different types of wastes into different color-coded bins. About 85% of the waste produced by healthcare facilities is general waste and non-hazardous in nature. The remaining 15% of waste is infectious or hazardous in nature that requires special management. Let's look at the benefits of segregation. Segregation prevents mixing of biomedical waste with general waste and thereby minimizes the quantity of infectious or hazardous waste. It reduces the chance of spread of infections or injuries to healthcare workers, rag pickers, and waste handlers. By reducing the quantum of infectious or hazardous waste, the cost of treatment and its disposal is significantly reduced. As a result of segregation of waste, hospitals will look clean and be hygienic. Segregation prevents pilferage of certain waste, like used syringes, needles, and other plastics, and hence prevents the misuse of waste. Segregation should be done at the point of generation of waste. Now let's look at how biomedical waste needs to be segregated. According to the Biomedical Waste Management Rules 2016, there are 4 color codes which we need to keep in mind. They are yellow, red, white, and blue. Color coding helps in proper segregation of biomedical waste and aids in its final treatment and disposal. Yellow bin. Let's look at what type of waste goes into the yellow bin. Human anatomical waste, such as placenta, amputated body parts, and dead fetus below the viable period. Animal wastes, such as rats, mice, and frogs, used for experiments and research. Soiled waste, such as dressings, cotton swabs, gauze, plaster of Paris cast, face mask, non plastic shoe covers, and head caps. Chemical waste, such as discarded disinfectants. We have other set of waste that needs to be pre-treated either by autoclave, microwave, or through non-chlorinated chemical disinfection before it goes into the yellow bin. They are blood bags, blood samples, microbiology waste, clinical laboratory waste, and biotechnology waste. Expired and discarded medicines also need to be segregated into the yellow bin, preferably a separate one. Cytotoxic waste needs to be collected in separate yellow bins which have cytotoxic symbol on it. Finally, contents of the yellow bin go for incineration or plasma pyrolysis at the common biomedical waste treatment facility. In places where there is no common biomedical waste treatment facility within 75 kilometers radius, contents of yellow bin go for deep burial. Don't put the following waste into yellow bins: any chlorinated plastic waste, any waste treated with chlorinated chemicals, pressurized containers, or mercury-containing waste. These wastes, if incinerated, can emit dioxins and furans. Now let's look at what should go into the red bin. The red bin is for contaminated recyclable waste, which primarily includes plastics and rubber materials. Examples of the waste that should go into the red bin are IV tubes and drip sets, plastic IV bottles, vacuuteners, Ryle's tube, syringes without needles, Foley's catheter, Eurosac bag, and gloves. Finally, the contents of red bin will be sent to common biomedical waste treatment facility where it is autoclaved, shredded, and then sent to registered recycler. In healthcare facilities that are not connected to the common biomedical waste treatment facility, the waste in red bin should be pre-treated by autoclave, microwave, hydroclave, or chemical disinfection and then handed over to registered recycler. White bin. Sharps waste have to be contained in white translucent, puncture-proof, leak-proof, and tamper-proof containers with biohazard symbol. Examples are cut needles, blades, scalpels, lumbar puncture needle, suture needles, syringes with fixed needles. In summary, all metallic sharp waste goes into the white translucent container. Finally, the container with sharps should be handed over to the common biomedical waste treatment facility, where it is autoclaved and shredded, after which it is either contained in sharps pit or encapsulated or disposed in sanitary landfill. In those healthcare facilities with no access to common biomedical waste treatment facility, sharps need to be chemically disinfected and then emptied into a sharps pit, which is constructed as per biomedical waste management rules. The last category of segregation is puncture-proof, leak-proof box with blue marking for glassware and metallic implants. Glassware that should be put into puncture-proof, leak-proof box with blue marking includes contaminated broken or intact bottles, vials, ampules, test tubes, and glass slides. Examples of metallic waste that needs to be put into puncture-proof, leak-proof box with blue marking includes body implants, screws, and plates. Now let's look at standards and requirements for segregation. For yellow and red bins, color-coded non-chlorinated plastic bags of not less than 50 microns with biohazard symbols are to be used. For cytotoxic waste, yellow bin with non-chlorinated yellow plastic bag of not less than 50 microns with the cytotoxic symbol is to be used. For sharps, white translucent, puncture-proof, leak-proof, and tamper-proof containers with biohazard symbol is to be used. For glassware and metallic implants, puncture-proof, leak-proof box with blue marking should be used. To summarize, we have yellow and red bins, white containers, and box with blue marking. Yellow for infectious waste, pharmaceutical waste, chemical waste, and cytotoxic waste. Red for contaminated recyclable waste such as plastic and gloves. White for metallic sharps. Blue for metallic implants and glassware. Remember, segregation should be done at the point of generation of waste.
Oh, sorry. Any questions you have?
Yes, ma'am.
Yes, Shravani.
Ma'am, if the gloves are rubber gloves and if it is contaminated, should we put it in yellow bin or still in red bin, ma'am?
That's what I told you. See, it's not about contamination. Everything is contaminated only. Even red is contaminated, right? Why do you think always contaminated should go
No,
into
if
yellow?
it got contact with body fluids, I mean.
Yes, yes, that will go into red, not yellow. Even red waste is contaminated. It is not all contaminated goes to yellow. I want to highlight it's depending on the material and what treatment plan we have, that we must keep in mind. Your
Okay, ma'am.
IV lines and all are not contaminated. They're contaminated, no, but we are putting in red because it has to be autoclaved and shaded.
Okay, ma'am. Thank you.
Okay, so it is upon the material you decide and put. All are contaminated. Your yellow is contaminated, red also will be contaminated. Some of them, white also is contaminated. Blue, only the metallic implants. The glass vials are unlikely to be contaminated, right? Little bit contamination. They are not much contaminated. So it's not about whether contaminated or non-contaminated. Gloves will go into red. Any other questions? Okay, thank you everybody. If you don't have question, I will close the session. Good day.
Okay, ma'am. Thank you, ma'am.
Okay, ma'am. Thank you, ma'am.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you.
Madam, one question.
Yeah, please.
Can you start writing assignments now?
Yes, you can start. Read. You have your
Uh,
books, right? Igno books you
I,
have got, models you have got, I think. You can read and write.
I don't got, but I can use Ignan course books.
Okay, no
I
problem.
will.
Start.
What is the deadline, madam?
What is that?
Deadline, last date to submit.
I think they would have mentioned in your this thing only, right?
Okay. Can I submit in MS Ramaya College or study center?
No, no, to ours. You are affiliated to our center?
Ah, yes, madam.
Okay. Then you
Okay,
can submit to us.
okay, madam.
Okay, thank you.
Bye.
Yeah, thank you.
पापा हमारे पास पेंसिल नहीं है क्या करें
अभी दिलवा दूंगी।
पापा तुम मुझे डेबिट दे दोगे
हम्म,
ठीक
तुम्हारे लिए नया दे देंगे।
है आराम पापा हमें एक कॉपी दे दोगे एक कॉपी दे दोगे बोलो